Hey everyone, Rachel Jolstrom here. Wanted to talk about just a few things real fast. First of all, love you all. Always will say that. We'll love you. Second of all, we don't talk about normalizing therapy enough. And so it's important for us to remember that therapy is not just about people who are in pain or suicidal or have trauma. Those are great reasons to go to therapy, but it's also because they want to work through patterns of behaviors that they want to change. And as a behavioral therapist, that is something that we work on the most. And doing DBT, that's really the thing we focus on is what is working for you and what is not working for you, and how do we work on those things together. We find things that are, of course, helping you be resilient and helping you to be much stronger in your everyday just life and skills that you've developed along the way. But we also work on things that you think are maladaptive coping behaviors. And those maladaptive skills are things such as addictions or spending money or overeating, whatever it may be. It can be any of those things that are causing you distress. Oftentimes, what we find in DBT is they're connected to very big emotions, and we just don't know how to regulate those emotions. So those are things that we work on. Those are small. It's a small little snippet about how DBT is most beneficial for you. But it's also beneficial with those really big moments, those crisis moments. So for instance, whenever you're having a panic attack or anxiety attack, or you've just had this really big news dropped in your lap and you're just not sure what to do with it. That's what we do. We work on those big emotions and really figuring out how to, first of all, regulate them. How do I cope with that moment? How do I make sure that that moment doesn't become bigger than it needs to? And it's really simple for us to be able to talk through that, learning how to validate yourself and learning how to ask for validation, and then learning how to problem solve later on really helps us to, again, mitigate the moment and for it to be not as impactful on other areas of our life. It's also relationship bound. So whenever we go through relationships and we are not sure about toxicity or if someone is the right fit for us, dating wise, or how to even ask for what we need. How do we even know what our needs are? How do we set boundaries? I mean, there's so many things with relationships that really cause us some kinds of distress. And so those are other ways that we can work through and find a way to really make the relationships more beneficial for you. When we grow up in a home, unfortunately, and this is not about growing up in a toxic behavior or a toxic household, but maybe we just grow up in a house that doesn't teach us those things, or they don't teach it based on our needs. That is where we work with you individually and we help you to find out what that looks like, how to ask for those things, how to set boundaries, and again, how to have healthy conflict, because healthy conflict actually builds relationships, not tears them down. So there's a lot of different ways that DBT can be effective. It is a therapy that was developed for borderline personality disorder. But whenever we stop and look at the other aspects as to what makes DBT beneficial, then it helps us to know that it's not about defining who we are with a disorder or finding identity in a disorder. It's more about saying, what kind of life do I want to live? And really setting those goals and being intentional and finding a person such as myself or a team that helps you on those days that are much more harder than you would think, and really help you to build that strength within yourself. So I hope that's something you consider. If you have any questions about DBT, you can always find us at findingmiddlepath.com. And we would be happy to work with you or help you, or to even help you find a therapist in your area that is more beneficial for around DBT and for what you're looking for. We also use things like Monarch and Psychology Today to find great DBT therapists. So don't be afraid. Normalize therapy. It's okay. It's okay to learn skills that you don't know. It's okay. I'm proud of you for reaching out and saying, this is something I didn't know and I want to grow in that. So give yourself some grace. Okay. Well, thanks so much. Love you as always, and talk to you later.